We are pleased once again to welcome back our good friend Cecilia Zalkind, who is Executive Director, Advocates for Children in New Jersey. Cecile, good to see you.
Thank you. Thank you for having me.
Every year, when my great friend and colleague, the terrific broadcaster Rafael P. Roman, would bring you on Capitol Report, we'd always hope you'd come back with this report on the children of New Jersey and say, things are great, they're doing great, they've improved. And this year on our new series, State of Affairs, I want to ask you, with this report, by the way, putting it into context, every year there's a report that is done that looks at what?
Well, this year we released 2 weeks ago our report that looks at Newark.
Right.
So it's a whole range of indicators of child well-being, health, economic well-being, education, child care, preschool. Later in the spring, we'll put out a state report. But actually, things are looking better in Newark.
Give us the indicators and give us the improvements.
I think there have been improvements across the board. Health is probably the biggest area. There are very few children, the lowest percentage without health insurance, which is very positive. Other health indicators are positive. Higher graduation rates. Child poverty has dropped a bit. It's still an issue in Newark. More families accessing the Earned Income Tax Credit. It's positive news across the board.
So more children having access to health care directly related to Medicaid expansion?
Yes, absolutely.
Explain that to people, because it's jargon, Medicaid expansion. What exactly does it mean?
Well, New Jersey actually has always had a very strong child health insurance program. It's dependent on federal money. It has a state match. We've had a program that's been provided pretty good coverage. There's certainly a family copay at higher incomes. But 3 years ago, states had the opportunity to bring down more federal money and expand it to more low-income families. What happened is it brought a lot of parents who did not have health coverage into the healthcare system. And we know from history that when parents are covered, kids are covered too. So we have greatly expanded access to health insurance for kids.
What is the Donald Trump presidential administration saying on this subject?
Well, the jury's still out, but it's a little scary. You know, we're watching very closely to see what's going to happen. The early indications, I think, to be honest, were frightening. The thought that we could simply repeal the Affordable Care Act.
Excuse me, you're making reference because we are taping in mid-April of 2017. The first effort to repeal and replace did not pass. Were you pleased with that?
Yes, but really it was just the first volley. Now we're waiting to see what else happens.
Well, here's my question. If, in fact, more children in the Newarks, in the Camdens, in the Trentons, in the Long Branches, Asbury Park, East Orange, Elizabeth, they go down the line. If, in fact, in those communities that, in fact, President Trump has said he's extremely concerned about the urban centers in this country, Chicago, New York City, et cetera, Los Angeles. If, in fact, more of these children are being covered than ever before, then why would his administration, through the Department of Health, want to change any aspect of that?
Well, I think we have that same question. This is a program that has succeeded. Yes, it probably has some things that need to be fixed. There are probably
some things... You're talking about the Affordable Care Act.
Yes.
Clearly there needs improvements.
Yes,
but in this area?
Not in this area. In this area, the support for low-income children and their parents, I think, has made a huge difference. And it's not just about health care. Health impacts on everything. We've been looking, for example, on chronic absenteeism across the state, and specifically in Newark. Big link to health because linking to absenteeism. It's a fundamental for families.
Families in Newark, what percentage of those families are living below the poverty line?
It's now 39%. So almost half, almost 1 in 2 children. That is actually an improvement. Last year it was a lot closer to half. But I think the more telling data is that almost 3/4, 70%, are considered low income. So this is 200% of poverty, about $47,000 a year for a family of 4.
Describe what they're facing. And beyond the statistics, beyond the dollar figures, one of the things you've always been able to do with Raf and I, when you've been on with us in the past, is to break this down in human terms, which matters most, not just to me, but more importantly, to our audience on public television, FiOS, and other places. Break it down on a human level.
Well, it impacts on everything. right? It impacts on a family being able to provide housing, stable housing, affordable housing for their kids. You know, we see a lot of families in Newark, particularly in some of the wards where the incomes have not increased, move around a lot because they can't afford rent. It impacts on what we would consider the basics, having enough food to put on the table. And all of that impacts on how well a child does in school. It is an immediate and a long-term consequence. Immediate in that well-being and health of the child, and long-term on that child's ability to grow up into a healthy, productive adult.
You know, I don't want to make this a referendum on the Trump administration and their policies regarding children, particularly in urban and poor areas. But the Meals on Wheels and the after-school programs for children who would often have a hard time getting access to food.
Yes.
I believe it was, and help me on this team, who was it who said in his administration that these programs are simply not working? Well, a top member of his administration. I believe it was that, in fact, the budget director who said these programs are not working. What do you think he meant by that, A, and B, how would we define working? And what would it mean, ultimately, a loaded question, I know, if in fact Meals on Wheels / after-school programs having to do with food for these children was taken away?
Well, I don't understand how it cannot be successful. You know, Meals on Wheels is primarily a program for the elderly.
Yes.
I look at someone like my father who lived to 96. Meals on Wheels enabled him to stay independent in his house that he built with his own hands, that he wanted to stay in. You know, if he didn't have that meal coming every day, he couldn't have lived there. For children, after-school programs are critical. When we talk to parents, often the number one issue is having a place for my child to go after school so that I can work. It doesn't make sense to me that these fundamental programs are on the chopping block.
And the federal government's involved in those.
Yes.
They fund them.
Yes.
And if they don't fund them?
If they don't fund them, I think New Jersey is in trouble. If you look at where policy and programs have improved for children, it's been federal.
Risky, and I don't want to be self-serving, but children in urban areas often dependent upon public broadcasting.
Yes, absolutely.
The Corporation for Public Broadcasting is in line for a major cut from this administration. Do you believe it has any implications, if in fact that cut were to stand and Congress were to approve it, in terms of the well-being of children?
Yes, I do. Personally, I believe that access to the arts, to positive programming, that's educational programming, and other arts opportunities are really important for children. Again, it impacts on their education, on their well-being. I think that would be tragic.
What message would you send to the president right now on behalf of the children of Newark and every urban community in the state and nation right now? I mean, these are the children you advocate for every day.
Well, I think first I'd say think about what you're doing. And then I'd say, come to New Jersey, come to Newark, come and meet some of these families and children. Come and understand what they face every day and how important some of these programs that you're talking about cutting are to them. Not, you know, fancy frills, just to maintain their well-being every day.
You remain confident, though, in spite of everything you see.
I am confident because I think we have an outstanding congressional delegation. We and other groups did a lot of work to give them information about what the impact would be on families in their districts, and I think it made a difference.
Cecilia, thank you. We appreciate it every time you're here.
Thank you very much.
Catch you next time again on State of Affairs. We appreciate it. Thank you, Cecilia.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by Summit MD Anderson Cancer Center, Delta Dental of New Jersey, Valley National Bank, Johnson & Johnson, New Jersey Resources, New Jersey Sharing Network, and by the North Ward Center.